This section of the cardiovascular system chapter on the heart is going to look at the anatomy of the heart and begin to look at its mechanical functions. This section will concentrate on the major structures in the heart that we're interested in. 4 chambers, 4 blood vessels that are connected to the heart, and the 4 valves that separate those and make sure that the blood flows in the proper direction. These pictures come with a lot of labels pointing out all the different structures of the heart. There's an anterior view and a posterior view. We can just look at the heart here, the anterior view especially, and picture the different chambers. Imagine, if you would, a Valentine's heart drawn around the structure of the heart here, with the apex of the heart being the pointy part of the heart, and then the base of the heart being where the 2 bumps are. And those 2 bumps are really representing sort of where 2 of the chambers are. There are 4 chambers. There are 2 on the right and 2 on the left. There are 2 superior on the base side of the heart and 2 inferior towards the apex. The superior chambers are called the atria, atrium for singular, and the 2 towards the apex are called the ventricles, which make up most of the heart. Now, as the heart's depicted in these pictures, the lighter pink region with the blood vessels in red and blue over them are the ventricles, and then the darker reddish to purple color is the atria. The right atrium and right ventricle are more anterior, and the left atrium and ventricle are more on the posterior side. You can see a little bit of all 4 chambers in both views, but the anterior view shows more of the right 2 chambers, and the posterior view shows more of the left 2. By cutting away the anterior wall of the heart and looking inside, we can see these 4 chambers more clearly. The right atrium and right ventricle, left atrium, left ventricle. We see these separated by a wall of myocardium called the septum. The intraventricular septum is visible here. The intraatrial septum would be obscured by where the right ventricle extends away and becomes the pulmonary trunk. We also want to consider the 4 blood vessels that are connected to the heart and the 4 valves, and those can be seen in this view also. Coming into the right atrium, we have the superior and inferior vena cava. The superior vena cava is coming from the upper body, head, neck, and arms, and then the inferior vena cava is coming from below. The blood goes from the right atrium into the right ventricle, passing through the tricuspid valve, and then the blood is pumped out of the right ventricle through the pulmonary valve into the pulmonary trunk, and that pulmonary trunk then splits into the left and right pulmonary arteries. The blood goes to the lungs through the pulmonary arteries and then returns through the pulmonary veins to come into the left atrium. Then the left atrium opens into the left ventricle through the mitral valve or bicuspid valve, which then goes into the left ventricle. The left ventricle pumps the blood out to the aorta through the aortic valve. Now, in a rendering like this of the structure of the heart, the aortic valve is seen to be kind of tucked behind the pulmonary trunk. In fact, from this view, you would not see the aortic valve because it would be completely behind the pulmonary trunk. We can see all 12 structures here, the 4 chambers, the 4 blood vessels, and the 4 valves that I've been talking about here. Valves are there to ensure that blood only moves in one direction. And there are 2 types of valves, 2 of each type. There are the atrioventricular valves, or AV valves, which are found between atria and ventricles. On the right side is the tricuspid valve, and on the left side is the mitral valve, which is also known as the bicuspid. Then there are the semilunar valves, which are between the ventricles and arteries. On the right side is the pulmonary valve, and on the left side is the aortic valve. Now, tricuspid as a name makes it sound like that valve is special because it has 3 cusps. But actually, all valves have 3 cusps except for the mitral valve, the bicuspid valve. So there's nothing special about calling that right atrioventricular valve the tricuspid. That's just the name that goes with it. And the left used to be called the bicuspid valve, but mitral is a more common name for it these days. The semilunar valves, then, are really named for the two arteries to which they're pumping. The pulmonary valve opens up into the pulmonary trunk, which is an artery, and the aortic valve opens up into the aorta, which is an artery. This is a dissected, opened heart showing a special feature of the AV valves. They have these tendinous cords, or cordi tendini, which attach the leaflet of the valve to the wall of the ventricle. We don't see those in semilunar valves or other valves in other systems in the body. The cordi tendini are there really to help keep the valve closed during ventricular contraction. The pressure that builds up when the ventricles contract becomes really great, really fast. And without the cordi tendini, it's possible that that pressure would push back against the valve and make it blow back the other way, which would be called prolapse, or would cause regurgitation against the valve. So the cordi tendini is attached by the papillary muscles to the wall of the heart, make the leaflets stay closed. They're sort of pulled down while the pressure of the blood is pushing back against the leaflets of the valve. A way I like to use to visualize how valves work is to think of them as the opening to a lobster trap like this. So this is a picture for a patent for a lobster trap that I found online. And the pocket in the middle, labeled 64 or 18 here, I'm not sure which, is where you'd put the bait, and then you'd close the trap, and the lobsters would crawl toward the trap, sensing the presence of the bait. The only way to get into the trap is through the funnel-like shaped openings, one on either side of the trap. The outside opening is big and it narrows down, so the lobster has to crawl through that funnel-like shape to get into the trap, and then it can't get back out the other way. Valves are kind of the same way. They're open wide at one side, like AV valves are open wide on the atrial side, and then they taper down onto the other side towards the ventricle. Now, a difference between the lobster trap and the valves is that the valves are moving back and forth. The leaflets flutter between open and closed. And when the blood fills the ventricle, for instance, with the AV valves, it'll push back against the valve and push the leaflets shut. So the metaphor only goes so far. In the next slide, I want to show you a little video animation of the valves closing and opening. It's made from two of the images in the book. One shows the AV valves open and the semilunar valves closed, and the other one shows the AV valves closed and semilunar valves open. It's a very rough idea of what happens during a heartbeat. Now, it's not really what happens during a heartbeat. There'd be some times when the valves are completely closed and the heart would be in a relaxed state. But just to see the idea of leaflets flapping open and closed, it's useful. The pictures are from a superior view with the atria removed. So we're looking down on where the valves are at the border between the atria and the ventricles, or where the ventricles are opened up to the arteries. This is a very simple animation just showing the valves flipping back and forth between open and closed, and not a real representation of a heartbeat. If we take the 12 items that this section's been about, the 4 chambers, the 4 blood vessels, and the 4 valves, and consider them in terms of how the blood moves through the heart, in respect to the body and the lungs, we see this setup. From the body, blood comes through the vena cava, inferior, superior versions, to the right atrium. Then the blood goes through the tricuspid valve into the right ventricle, and then through the pulmonary valve into the pulmonary trunk, which takes it to the lungs. And then returning from the lungs, the blood goes through the pulmonary veins into the left atrium, and then through the mitral valve into the left ventricle, and then through the aortic valve into the aorta, which returns the blood back to the body. So considering the body and the lungs as two sort of centers of circulation, we see that the right side of the heart is responsible for pumping blood from the body to the lung, and then the left side is responsible for pumping blood from the lungs back to the body. The two sides really are separate. Here we see that represented in the heart, colored based on the type of blood that's moving through it. Blue represents deoxygenated blood that's been used and is being pumped from the body back to the lungs, and red represents oxygenated blood that's coming from the lungs and headed back out to the body. Blue is seen only on the right side, and red is seen only on the left side. And if we consider the circulation in the entire body, we can see how that works out to bring oxygenated blood out to the body and then return the deoxygenated blood back through the heart to the lungs to get reoxygenated and blood brought back through the heart to the body to reoxygenate tissues. Now, the colors again are about the blood, state of the blood, but you'll often see red and blue associated with arteries and veins, but that's actually a misconception based on anatomical models. Red means oxygenated, which is usually seen in arteries, and blue means deoxygenated, which is usually seen in veins. But actually, arteries are vessels that carry blood away from the heart, and veins are vessels that bring blood to the heart. So the pulmonary trunk is a blue-colored artery because it's carrying deoxygenated blood away from the heart. And the pulmonary veins are red veins because they're bringing oxygenated blood back to the heart. There's two circuits here. There's the systemic circuit, which is bringing the oxygenated blood out to the body and returning the used deoxygenated blood back, and the pulmonary circuit, which is taking the deoxygenated blood, going through the lungs, getting reoxygenated, and then bringing it back. The systemic circuit follows the arteries being red and veins being blue color scheme because arteries are carrying the oxygenated blood away from the heart to the tissues, and the veins are carrying the deoxygenated blood back from the tissues to the heart. In the pulmonary circuit, things are backwards. Arteries are carrying deoxygenated blood that's been pumped from the right side of the heart to the lungs, and the veins will carry the reoxygenated blood back to the left side of the heart. So if you're used to the red for artery, blue for vein misconception, that's still kind of valid if you remember that it only counts for the systemic circuit. For the pulmonary circuit, it's the opposite. Consider this question. When you feel that you've reached an answer, hit the next button to go into the next slide, which will reveal the correct answer. So if we consider just the movement of blood through the ventricles, we'll see that blood enters the right atrium, goes to the right ventricle, and then eventually gets back to the left atrium and to the left ventricle, then goes out to the body and repeats the whole thing all over again. Because of the valves, blood's only going to move in one direction, short of regurgitation or prolapse through a valve, which is a very rare occurrence. So D is the correct answer here.